So often as a GP, I see patients either in the surgery or at home who have suddenly become more unwell. They're often older, frail people, and sometimes we feel like the only option to keep them safe is to admit them to hospital. But we know that if we could care for them at home, if they could get the extra support that they needed, that we can often treat them at home and allow them to get better at home. The urgent community response allows us to do that. By referring to the urgent community response service, an assessment will be made by a multidisciplinary team to see what care is needed to keep that person at home. It might be an elderly lady who has had a fall and needs some help to recover from that. It might be an elderly man who's got a urine infection, and that means that he needs some extra help whilst he's getting better.
So the service operates 8 till 8, Monday to Sundays, 365 days a year. The cut-off for referrals is 6:30 p.m. We don't always have to visit the patient. There are things that we can do to keep them at home, maybe video calls, something that can be sorted over the phone.
In urgent community response, my role is to support the clinicians. So we have nurses, occupational therapists and physiotherapists, and every day is different. So I go out and see lots of patients within a 2-hour time frame of them being referred. So when I start in the morning, I don't know what my day is going to look like. It depends on what referrals we have that come in. So ideally we're looking to keep people at home, hospital avoidance and reduce risks of fall. So tend to see the elderly. So we have gone out and seen palliative patients, and they always seem to stick in my mind because they're the patients that need a lot of support just to help them keep their dignity in their sort of final days or final weeks and remain in a place where they want to be. So some people don't want to go to hospital, they want to remain at home, and they do need a bit of support to do so.
On a one-to-one basis where we're seeing patients, you can walk away most times thinking, oh yeah, well actually that was a pretty good job, or we're able to offer something that will get them over that hump. And that's how I explain it to the patient very often and the family. Let's just get you over this hump. Let's see you out the other side. And in most cases we can do that.